So dear students, today we will talk about pancreatic insufficiency. So pancreatic insufficiency is actually a problem where pancreas cannot produce its exocrine enzyme. So we will say definition, it is a condition where pancreas cannot produce or deliver enough digestive enzyme, and this result in malabsorption. So this result in malabsorption, and this malabsorption is specifically fats malabsorption because fat related enzymes are deficient earlier. Then we will talk about the causes. Causes include cystic fibrosis, chronic pancreatitis, and obstruction. So these are the three main causes which are causing the pancreatic insufficiency. Then if we talk about the pathophysiology, so we know that normally pancreas produces lipases, amylase, and proteases. So pancreas normally produces lipase, amylase, and protease. And now remember one important point, that deficiency of lipase is the earliest and most severe deficiency. So it is very important to know that the deficiency or decrease in lipase is the earliest and most severe deficiency, and this results in fat malabsorption. So fat malabsorption causes what main thing, that is steatorrhea. So if we go toward the clinical feature, then in clinical feature, as we know that the fat malabsorption is most common and most earliest symptom that cause steatorrhea. So actually steatorrhea is bulky, oily, foul-smelling stool, and we will also see other symptoms that include bloating, flatulence, chronic diarrhea, and FTT mean failure to thrive. So these symptoms are also seen. Other than these symptoms, we will also see some nutrition deficiencies. And these nutrition deficiencies include fat-soluble vitamin deficiency, and we know that these are ADEK. And we will also see vitamin B12 deficiency. So fat-soluble vitamins and vitamin B12 deficiencies are seen. Then if we go toward the diagnosis, then we do most commonly fecal elastase 1 test, and this is enzyme that is produced by pancreas, and if it is less than 200 microgram per gram of the stool, then it is the case of pancreatic insufficiency. So it is decrease in the pancreatic insufficiency because pancreas is not working its normally. Then we will do 72-hour fecal fat test, and in this case there is increased fat excretion, and that is more than 7 gram per day. So if it is more than 7 gram per day, this means there is some malabsorption. Then we will also do some imaging techniques that include CT and MRI. So this is the diagnosis. Now if we go toward the treatment, then in treatment we replace the enzymes that are deficient, and that is called as pancreatic enzyme replacement therapy, which is also called as in short form PERT. And then we do some dietary changes. In dietary changes we allow moderate fats. We should not decrease too much fat, we can use moderate fat. Then we will also we will take small frequent meal instead of one large meal at one time. So we should take small frequent meal at various times, and we should avoid alcohol. Then we will also use some vitamin supplementation that include fat soluble vitamins, because we know that in pancreatic insufficiency most commonly fat soluble vitamin are decreased. We also know that vitamin B12 is deficient, so we will also take vitamin B12. And then we will treat the underlying cause. So any cause obstruction, chronic pancreatitis, or cystic fibrosis, we will treat that. Anything that causes this pancreatic insufficiency, we will treat that cause. So this is the pancreatic insufficiency.